We are here to talk to you about our GP project about the well-being of our teachers.
Okay. So can you introduce yourself, tell me your names?
I'm Siona. I'm Samar.
I'm Agastya.
Okay, so can you tell me about the project?
So most of the teachers stand and they write a lot. They correct the papers. So they have they have pain, knee pain, joint pain. So we wanted to talk to you about that.
Okay. So what is this project about actually? What will you do after this project?
So what we are going to do is that we are going to ask you a few questions. We are going to conduct an interview with you, and then we are going to
Basically, teachers stand all day or sit all day correcting papers and they don't get like a proper break. They're always like working. So then they get a lot of pain like in their hands, their elbows, their joints and all that. So we wanted to ask you like what are the things we can do so that the teachers can get less pain in their...
Okay. Very nice. So you want your teachers to be fit, right?
Yeah.
So they can teach you. Huh?
Yeah.
Okay. So what are questions do you have? So let's start with Agastya first.
how does poor posture while teaching or correcting papers affect the spine?
Okay. So you should understand the difference between a poor posture and good posture. Right? Let's say you are sitting on a bench. Let's say I am sitting on a chair. Okay. So let's say this chair is bent like this, right? It is at 90 degrees.
Yes.
Let's say I am sitting like this, leaning back. So this is a poor posture like this.
Yes.
Why? Because if you are sitting like this, your spine will be at risk. You will get a lot of muscle pain in the back. So what is the correct way to sit? Like this. The back should go completely syndrome. It's the name of the disease in which what happens if somebody is working on a desktop for a long period of time, and if their desktop, their sitting habits, their position of the finger and the wrist are not good, they get a lot of pain, they will get a lot of tingling sensation in their fingers. And then the strength of their hand becomes less. Let's say they want to pick up something, then the thing will fall down because their hand becomes weak. Why does this happen? Because when they are working on the laptop, the pressure on the nerves here increases. And when the pressure over the nerve here increases, the signals doesn't reach to the fingers. And the muscles and the bones become very weak. Okay, that's why it's called carpal tunnel syndrome. Nowadays, you should understand all these desktop, laptops come with a special design to prevent this problem. They are called as ergonomically designed desktop. What?
Ergonomically designed. Ergonomically designed.
Wait. It's called ergonomically designed laptops to prevent all these problems. Okay? And all the teachers who get this or at risk of getting this, they should take proper vitamin B12 supplements at regular intervals. Okay? See you.
When should a teacher seek medical help instead of ignoring the pain?
So it is for everybody, including your teachers. So anybody who has got a back pain that doesn't subside in 7 days of time, anybody who has got on elbow pain, wrist pain, which doesn't subside in 7 days time, it may be some simple therapies at home. She should visit a doctor to understand what is the cause of that pain. Okay, so they should not ignore. Okay, it's a mild pain, it will go away like this. I will keep on continuing teaching, coming to the school. No. If the pain persists beyond 7 days, then she has to come. Okay?
How does standing or sitting for long hours affect our spine and knee?
Okay. So, standing usually will not affect the spine, but standing will affect your knee joint. Okay? Now, whenever you are standing for a long period of time, the circulation of the legs is less. So, all those people who are in a profession of standing for prolonged duration, teachers has to stand, right? So, they are at risk of having something called as varicose veins. What happens? You must be knowing that impure blood goes to your heart, it gets purified, and then pure blood goes to your hands and legs.
Yes.
Now, whoever is standing for a long period of time, the impure blood doesn't reach the heart. So what happens? It gets accumulated in the legs. If it gets accumulated in the legs, our blood vessels become very prominent and big. That can cause a lot of pain in the ankle, calf and knee. That problem is called as varicose veins. Okay, so teachers should be aware of this, and they should take frequent breaks. That means what? Every 30 to 40 minutes they should take a break of 5-10 minutes. They have to sit, take rest, again they have to stand up and again teach you for 30-40 minutes. You should not continuously stand for more than 30 to 40 minutes. If you do that, then you can develop this problem. Understood? So you have to tell your teacher, please take break, sit for 5-10 minutes, and again you can again teach me.
Are teachers at high risk of back, neck or knee problems compared to other professions?
Yes. So what teachers do after your examination? They have to check your papers, right?
Yes.
And how are they going to check the papers?
Right.
They sit on a chair and they will be checking like this, right?
Yes.
Okay. So every time when you are doing like this, the pressure will be on the back and on the neck, right?
Yes.
So for those teachers who will be checking papers, or let's say they have some desk bound or sitting job, they should also take frequent breaks after every 30 minutes. So when we are working, we are not aware if there is any problem in the body. What happens if you don't take frequent breaks? Then maybe next day teacher will come and there is a lot of neck pain, a lot of back pain, and she's getting a lot of soreness because of that. She is not able to bend, she is not able to lift anything. Understood? So all teachers should compulsory take break of 5 minutes when they are checking patients, so that their spine, that is neck, and the back muscle gets completely relaxed. Okay? And most important for back and knee are exercises. You do exercises. Your parents do exercises. You go to gym. They do yoga. Yes. So why they do? This is to keep their muscles stronger. Okay, spine and knee stronger. So tell your teachers that they should also find some time, at least 30 minutes, so that they can do some exercise. Understood?
Doctor, so like how you had said that the teacher should take break every 30 to 40 minutes. What, like some exercise they have to do every 30 to 40
No.
minutes?
They can't do exercise when they are teaching
Like
you,
simple
right?
exercise.
What? Let's say I'm sitting here, I'm talking to the patients, I'm doing some project and I'm engrossed in that, right? So every 30 minutes I'll just get up, walk around, come back and sit. Okay, I don't have to do an exercise. So only if I'm changing the posture, that automatically relaxes your muscles actually. It gives rest to the muscles. And again you can come and sit. No exercise, exercise only in the morning.
And like when they're sitting down, then they have to stand up.
Yeah.
And when they're
Standing
standing,
they have to sit. Yes. So they have to change their position after every 30-40 minutes so that the muscles get relaxed. Okay. Understood? Done?
No.
Done?
Yeah.
Adya, sorry. Adya.
How does age or years of teaching impact joint health?
Okay. So now let's say any teacher who is working in the school for more than 10 years, right? So what are their daily activities?
They just teach.
No. Daily activities when they will be standing.
Yes.
So are they going to walk a lot? No, right?
No.
So most of the time they are either standing or they are sitting.
Yes.
Okay. So what happens if you are not doing walking? So your lower body, that is including the hips and the knee joints, okay, then the nourishment to the joint is less. So teachers are at high risk of having arthritis in the knee joint and hip joint. And to prevent that, they should daily do walking for at least 40 to 45 minutes, either in the morning or in the evening. So let's say you want to make your muscles stronger. How do you do that? You do exercise.
Yes.
You take some protein supplements.
Yes.
Okay. You drink milk. Okay. But for the joint, there is no blood supply. So how do they get their nourishment?
By
So,
walking?
no. So by walking, that is cyclical motion of your knee joint. Every time you are going to stand, you are going to walk, you are going to climb stairs up and down. There will be some nourishment to the knee joint. The more you do that, your knee will be more stronger. The less you do that, your knees will be weak. If your knees are weak, then obviously you will develop some kind of deformity, you will develop some pain over a long period of time, not immediately. All this problem happens if you are in a teaching profession for more than 15 to 20 years. Okay? So you have to ask your teachers to do daily exercise for their back and the knee.
Walking.
Yes. Understood, Adya?
So while teaching they can like walk and see and
Yes. So you should ask your teacher that do not stand or sit at one place when they are teaching. They can move around. Okay? So let's say 15-20 minutes they are standing and teaching you. Then ask them to sit for some time. Ask them to move around in the classroom and then teach you. They are not supposed to just sit or stand at one place and teach you. Understood? So they have to keep on moving. They have to keep on moving in the class. Okay? Next, Adya.
how can physical
Okay. See, any person who is in pain, obviously he won't be able to work, right? Let's say I have got a knee pain or I have got a back pain. Okay. So if I have got a knee pain, would I be able to walk properly? No, right? Would I be able to walk far? I'll be limping, right? Okay. So obviously when somebody is in pain, he won't be able to stand, he won't be able to walk properly, and somebody is in pain, he won't be able to teach you also, right? Okay. So obviously whenever somebody is in pain, the energy level of that person goes down. Okay. And professionally, basically they won't be able to teach you properly. Okay. So they should not be in the pain, they should be physically very fit so that they can teach you properly. Understood? Okay.
Most common orthopedic problems you see in teachers.
Okay. So what your teachers do? You usually stand.
Yes.
They teach you on the blackboards. So what all joints are involved?
Wrist,
Okay. Wrist,
elbow, and shoulder.
So every time they are going to stand, they are going to write like this, right? For a long period of time. So this movement of the hand is very common when they are
Yes.
teaching you, right?
Yes.
So what all things can affect them? First thing is shoulder. Let's say if their posture is not right, let's say if they lift something heavy in improper posture, then the muscles can get injured. Okay, if the muscles gets injured, she might get a shoulder pain. What that condition is called? Sometimes it is called as tendinitis.
10 minutes.
Okay, some teachers might get frozen shoulder as well. If they use lot of force, they may get muscle tears as well. Okay, what is the common problem they face in the elbow? Common problem they face in the elbow is tennis elbow. What do you mean by tennis elbow? Let's say if they are lifting something heavy, they'll get a lot of pain over this part of the elbow. Okay, why? Because the muscles of your finger, they start from this bone. Okay, if they get swollen or inflamed, this is called as tennis elbow. And the last is, I told you, is the thumb and the wrist. Okay, so when they are writing, there is a lot of pressure in the nerve over here, and they can get some pain, tingling sensation, numbness, weakness in their hands. That condition is called as carpal tunnel syndrome. Okay, these are the common problems usually I see in the teachers.
What simple habits can teachers follow to protect their bones and joints?
So, can you tell me what is the common source of vitamin D?
Sun.
So sunlight is the only source of vitamin D for our body. It is not available in the food. It is not available in the fruits. So most important is your sunlight exposure. Your body should be exposed to the sunlight at least for 10 to 15 minutes daily. Okay, if you have a good amount of vitamin D in the body, then the absorption of calcium in the bones will be good. So your bones will stay stronger. Okay, let's say now if you are not getting sunlight exposure regularly, adequately, let's say in the winters, you don't see sun, right? So at that time you should ask your teachers to take some calcium and vitamin D supplements. Okay. Second thing, because they are using their hand, their knees, they are sitting, they have to do regular exercises. I told you, right, all the exercises how to do it. They have to do it daily in the morning for 15 to 20 minutes so that their joints don't ache and they have good function of their shoulder, wrist and elbow muscles. Okay. Every morning when you get up, okay, you have to do these exercises. All the exercises which I have shown you, you have to do 10 repetitions. How many? 10 repetitions. Okay. You should start with your neck, shoulder, elbow, back, and it should come down to your knee. Okay. It will not take more than 20 minutes. If you do a proper 20 minutes of exercise in the morning, then your back, knee, neck, everything will be healthy. Okay.
Yes.
Doctor, for supporting us. Now we'll create a brochure and give our teachers the demo.
Okay. Very nice. Thank you.